Peter Best, as you hear, and my pleasure is that I'm with Professor Enrique Mathieu from the University in Barcelona, and also of Spain's CRESA Animal Health Research Center. At this virtual perspective, we're recognizing the 2020 winners of the European PRRS Research Awards. And just to remind you, if I may, before we start, the three winning proposals are led by Dr. Pia Heisenberg from Denmark, Dr. Erhard van der Vries in the Netherlands, and Dr. Guillermo Remis in Spain. Dr. Mathieu, you're the chairman of the independent review board that has examined the submissions for these latest awards, from which the three winners were chosen. So the obvious question to start with, I guess, is why these three?
Good afternoon and welcome everybody to this interview, and nice to see you again, Peter. So answering your question, the first thing that I have to do is that it was a very difficult time just to select just three, because the number of proposals was high and all of them were very good. Why we did select these three? Okay, obviously because they were the best ones. Obviously, this was the main reason. And secondly, because all three were addressing very important topics for PRRS research in the context of Europe. One of the proposals, the one from Dr. Heisenberg in Denmark, was addressing the impact of different systems of weaning pigs. This is really important because these days we are very good at producing huge amounts of pigs. We have very high prolificity animals, very good sows. And the problem is how to wean this big number of piglets. And in some farms, they decide just to produce in all-in, all-out system. This is what the biosecurity rules say. But in other farms, they prefer to keep some animals for a couple of weeks just to balance the weight of the animals that are entering the nurseries. And obviously, this implies a very huge mixing of animals within the farm. The problem is that from a, let's say, theoretical basis, we know that this mixing of animals is very good for the virus because it promotes transmission between different groups. But we don't really know what is the impact in economical and health terms for the farm. So maybe some farms that are doing that are producing a huge negative impact in the farm, but maybe it's not like that. So this is an important point to be addressed. The second proposal that we have among the awardees this year was from Dr. Remis in Murcia in Spain, and that proposal dealt with the biosecurity, the assessment, the quantitative assessment of the biosecurity measures. And this is really important. For many years, we have been using biosecurity as a means of controlling the entrance of new pathogens in the farm. But we did the assessment basically more on qualitative traits. I mean, we know very well that some things are harmful for the health of the farm, for the biosafety of the farm, but we cannot produce a clear estimate of the impact of doing one thing or the other. So this project aims to that, to know the exact, the quantitative impact of some measures, and obviously to have a general overview of the biosecurity on the farms. And the third project that was awarded was the project from Dr. Breeze, and that project was aimed to understand where and how frequent is recombination in PRRS. And this is one of the topics of today's talks, because our approach to that has been very simple, and that's last year. We have been using sequencing of small pieces of the virus is very informative from a point of view, but it's not enough to understand really how this mixing, how this interaction between different strains, whether vaccine strains or wild-type strains, how these genes move between different farms, different strains circulating in the field. And the project is aimed to understand that, and of course, this is a very hot topic today.
Yeah, each of those is addressing something for which we need an answer clearly. Was that one of the main criterion for choosing these three winners then? Was it not so much their novelty, but the potential for the answers that they could produce?
Of course. I mean, Obviously, the scientific criterion is in there. I mean, the proposals have to be sound under a scientific point of view, but also they have to answer practical questions and they have to produce an impact on the production. So these were the three main lines for which the assessment was done for the proposals.
And when you looked at these proposals compared with others that you received, I'm sure there are quite a number of others you received this year. Were they clearly the three winners, or was it a close decision in the end?
Maybe this year was the toughest in all that time, because they were really close one to the other, really close, really. It was very difficult to reach a final decision because all of them were very good. They were very close.
I'm with you. So in 2020, we have a winning proposal on genetic recombination in PRRS, but also others on the farm practice questions of biosecurity and weaning procedures in relation to PRRS in the nursery, as you've explained. Does that suggest more winning projects, Dr. Mathieu, that research farm management in relation to PRRS, do you think?
I'm not sure, because this is kind of a little bit. It's kind of a fashion. I mean, you have days in which the fashion is recombination, some other days in which the fashion is biosecurity, some other days in which the fashion is vaccination. What do I mean with that? I mean that obviously day after day, year after year, we are producing new knowledge, and this new knowledge produce answers to some questions, but also these new answers produce new questions. So when you have an advance in one area, you produce a lot of questions, and that means that the attention is focused on that. So this year, for example, there were a lot of proposals on diagnosis on a herd basis. There were a lot of proposals on managing biosecurity on the farm, and that's normal, because we are moving from individual diagnosis. This is pretty well done at this moment, to herd diagnosis. We are moving from controlling the disease to preventing disease, and certainly this has an impact on the proposals that we are receiving.
Yeah, so that is an important direction then, if we're talking about prevention as well as control. Do you think then that these three are indicative in another way? I mean, you've got one from Denmark, one from the Netherlands, and one from Spain. Have you had submissions from all over Europe this year?
Yeah, we have also from friends that I remember, and from other countries, and obviously the aim of this type of calls is to have to represent the diversity that we have in Europe. In my opinion, one thing that is very differential in Europe is that in a very small space, because Europe is very small compared to America or to Asia, we have a very big diversity of production systems. We have a very big diversity of ways of understanding pig production, and our aim in this call is to have a picture of all this included.
Now, as well as across Europe, I noticed one of the winners is a practitioner, Dr. PRRSpective. Did you receive many proposals from practitioners this time?
Well, that's difficult, and it's very understandable. Why? Because when you have to prepare a proposal that is a scientific proposal, it's kind of a little bit like, okay, I'm a practitioner, I'm not a I'm not a scientist, so I cannot produce this type of proposal. This is not the case. I think every year and year after year we are having proposals from practitioners, and year after year we are promoting practitioners to present proposals, because my personal view, and I think that Beringer's one, is that practitioners are the one that most closely see the impact of the disease. So they know the real practical problems that have to be solved in the farm. And obviously this needs a component of science behind that. You cannot solve problems without science. But obviously they are the first ones recognizing the problems in the farm.
You've referred to the past of the awards. Now, you yourself, of course, have been involved with the European PRRS Research Awards since it was started. The program was started by Boehringer Ingelheim in 2014. That's correct, isn't it?
Yeah.
You're chairman of the board, of the review board. Do you detect any patterns or any trends over time in the type of research project being proposed?
Yes, certainly. At the beginning of these awards, the main focus was probably on diagnosis. We were still moving whether it was better to analyze individual animals or to use aggregate samples, or the value of aggregate samples for understanding the dynamics or the status of the farm. Obviously, analyzing individual animals is very labor consuming, time consuming, and money consuming, while using aggregated samples is more convenient. At this moment, the value of this sampling using oral fluids or other type of aggregate samples, I think it's pretty clear. More or less, everybody knows the pros and the cons of these systems. And little by little, we are focusing toward all things, for example, towards prevention, how we can avoid the infection entering the farm, or if the infection enters, what else we can do beyond vaccinating. And I think that this is gaining importance. But anyway, you have always proposals based on vaccination and based on diagnosis, because at this moment they are still the basis of the control of birds in the farm.
I'm going to take the last few minutes, and we are very limited for time, to ask you to look back, because you've been with us since 2014. It means in 2020, we've seen the 7th year of these annual awards, in which Boehringer Ingelheim provides a grant of €25,000 to fund each of the 3 research proposals selected by the Independent Review Board. By my calculation, that means 21 pieces of PRRS research chosen for funding over the past 7 years. What particular pieces of information about PRRS would you say we have gained from the research, from the awards program?
As I told you before, in the first years, there were a lot of proposals on diagnosis, on vaccination. Now we have, I think, a pretty good idea about how we can use different samples to assess the status of the farm based on oral fluids, based on piglet testing, based on umbilical cords. We have produced, between the awardees have produced a very good understanding of the role of maternally derived antibodies and then the potential interference of these antibodies with vaccination. And this was a very important point, because the trend for many years have been and still is towards earlier vaccination. So this interference with maternally derived antibodies is a very critical point for understanding that. Or, for example, we also have been, within the context of this award, we have been seeing projects produced and published on the dynamics of the virus, and also on the potential recombination or the difference of different approaches of sequencing in the farm. So I think that the contributions are quite relevant.
Yes, I did notice when I look back, 2014, 2015, it was antibodies in sows, and then there was starting to be 2016 and so on, looking at things like using oral fluids instead of serum for testing, which has become quite a common topic these days, of course. And we're certainly looking at sampling oral fluids in the latest round of the winning proposals, aren't we? And then there was more about the vertical transmission of PRRS in about 2017. But 2 proposals in particular caught my eye in 2018, Professor Mathieu. One on tracing PRRS strains by sequence analysis in the viral genome, and the other about the risk that an influenza A infection could interfere with the success of PRRS vaccination. Both of those remain hot topics, don't they?
Yeah. One of the things that we really don't know as much as we should is how the virus circulate in the farms, within the farms, or between farms. I mean, it's pretty clear that if you introduce an infected animal in a farm, you will produce the infection will be transmitted, and it's pretty evident that there is transmission within the farm. But what is not that clear is how this transmission happens, what are the ways in which the virus is transmitted. So tracing molecularly the movement of the virus in a production system can produce important information regarding the ways in which we can stop this transmission. And regarding the other project, can you remind me the second one, please?
Yes, I
One
was
was about
saying that. Yes,
influenza.
well,
Okay,
tracing and then the influence of influenza A. Yes.
yes, this is also very important, a very important point. You have to think that in most farms, the respiratory, let's say, the respiratory form of the infection is very important. Many nurseries are infected by PRRS, and this causes respiratory disease. But also many of them, not to say all, they are infected with influenza. So understanding the interaction between these two pathogens, how one can favor or how one can block the infection of the other is really, really important, because at the end, what we have is a complex, a respiratory disease complex within the nurseries. So the final result of this complex is the final interaction between all these pathogens. So I think it's pretty relevant also to understand if they are interacting for good or for bad.
So we could perhaps look forward to further projects in the European PRRS Award program that will look at such aspects for us and provide more information on which we can base veterinary advice. But thank you then, Dr. Mathieu. I'm afraid we've run out of time at this virtual perspective, but for today, may I say many thanks. I look forward to hearing the outcome of those three winning proposals, which I suppose we'll hear something about in a year's time, will we?
Yes, for sure. Thank you very much. You're very welcome.
Thank you. Thank you for your attention. Goodbye.